Right, I'll go ahead and get started now. Hello, everyone, and thank you so much for being here and taking the time to listen to my informative speech. Right, so, while they were saying among themselves, it cannot be done, it was done. Quote by Helen Keller. Today, we have to face the harsh reality that numerous people around the world have to suffer and die as a consequence of the disease that we call cancer. Cancer has no clear cure, and despite it having treatment methods, when you're diagnosed, it's hopeless. However, with some of the developments that are going on in modern times in the realm of cancer treatment research, I and many others have confidence in the future of cancer treatment and the potential of a cure. So it can be said that when asked, can there be a cure for cancer? Is there going to be a cure? We can reply to them and say, it was done. The purpose of the speech is to educate you on the new type of cancer treatment by the name of histotripsy. Histotripsy is important to learn about as it is very different in comparison to conventional cancer treatment methods, and it is very effective and efficient in what it does. I'm qualified to present on this subject as I have done extensive research on it through reading many articles about its relevance and how it works and watching many clips on it as part of an internship. And in order to give you the best overview of histotripsy, I will have to break down the speech into three main categories. The first will start on how it works, the second will discuss its importance, and the third will discuss some of the subtle disadvantages it has. So, starting off with how it works. So, similar to throwing darts on a dartboard towards a specific target, in histotripsy, excited microbubbles work to shoot at specific target cancer cells within a said tumor or mass. These microbubbles are excited within the tissue through the utilization of ultrasound waves, and um, and the subtle waste that's created from this process is easily disposed of uh, by the body's immune system. Another usage of the ultrasound throughout this process is that it can also give physicians a detailed look at the cancerous mass before and during the treatment, stated by journalist Jim Lynch, writing an article on the revelations made by the Michigan engineering team at UMich, meaning that this procedure is very much effective in comparison to the others, and that it is helping specialists look at the internalities throughout the course of it, make sure that everything is going correctly. So now discussing its importance. So, histotripsy is a powerful tool for doctors to treat certain tumors without any needles, radiation, or surgery, even allowing most patients to go home the same day. The histotripsy team at U Chicago states. It is a non invasive procedure, meaning that it doesn't involve inflicting patients with any direct source of pain through injections, and it doesn't have as many side effects in comparison to traditional cancer treatment options like chemotherapy, according to the American Cancer Society, which works to really emphasize on the brutal effects of chemotherapy. Chemotherapy can result in side effects such as damage to hair follicles or blood forming cells. Additionally, a lot of companies, such as Histosonics, are working to manufacture a lot of electronics and technologies that are enforcing histotripsy in order to make this development widely available. Now, to discuss some of its downsides, it's still being tested. It's not widely accessible yet. However, according to Swedish Health Services, there is a 95.5% success rate for the clinical trials that have taken place so far. So it does have a lot of potential. And even though it doesn't have very many side effects, it still does have some side effects in that it is destroying your internal tissues. So it is likely that you may develop some internal bleeding as an effect of the process. But with this development, there is hope for researchers that there will be a cure for cancer soon, and there is hope for patients who are longing for a better type of treatment that isn't the type of treatments that they've had to undergo so far. Despite it being not widely accessible now, it is going to become widely accessible soon, and its non-invasive properties and how quickly it can be enforced make it so much more preferable to patients. And with this, I say it can be done, it will be done, and I will be able to say that it was done, as this is the step that needs to be taken in order to end the probability game. Thank you.